Millions of children heading back to school after the holiday could soon have extra protection against COVID-19. The FDA authorized vaccine boosters for children ages 12 to 15 on Monday. The agency says everyone in that age group can now get a third dose of the Pfizer vaccine just 5 months after their second dose, instead of 6 months. The CDC still needs to sign off on the authorization. Meanwhile, new infections are surging across the nation. Nearly 56 million people have contracted the virus, and more than 827,000 have died since the start of the pandemic. The country averaged more than 400,000 infections each day over the past week. Let that number sink in. Meg Oliver reports from New Jersey.
Tonight, as more children enter the hospital infected with the Omicron variant, the FDA says those as young as 12 can now get a third dose or booster of the Pfizer vaccine. Despite surging COVID cases, millions of children returned to school today, including in New York City.
I'm going to tell you what's going to happen day to day. We are staying open. We're going to do everything that we have to do to keep our schools open.
The city is doubling the number of students tested in each school and providing an additional 2 million test kits.
How are you?
In Washington, D.C., the number of new cases jumped 331% in the last 2 weeks. The nation's second largest school system, Los Angeles Unified, has ordered students and staff to undergo mandatory COVID testing before classes resume next week. But out of more than 13,000 school districts in the country, less than 150 have decided to start the semester with all remote learning. Paterson, New Jersey is one of them.
I think that it's a good thing that the children are going to be home.
Tiffany Jacobs has 5 kids in the Paterson School District.
I'd rather my kids be safe and not get sick.
And new questions over the CDC's isolation guidelines. Last week, the agency reduced the isolation period for asymptomatic positive cases from 10 days to 5, but did not require a negative test. After much criticism, the White House's top medical advisor says the CDC is now reconsidering.
Looking at it again, there may be an option in that testing could be a part of that. And I think we're going to be hearing more about that in the next day or so from the CDC.
Here in Paterson, remote learning will begin tomorrow morning until January 18th. Meantime, the FDA announced that everyone eligible for the Pfizer booster can now get one as early as 5 months instead of 6. Nancy?
Meg Oliver, thank you. For more, I want to bring in Dr. Hlatshwayo Davis. She is an infectious disease physician at John Cochran VA Medical Center and the Director of Health for the city of St. Louis. Doctor, thank you so much for joining us. Let's start with this big news about the FDA's authorization of booster shots for kids ages 12 to 15. Do you think this is going to be enough to slow this huge explosion we've been seeing in childhood hospitalizations?
Well, I don't think that any one thing is going to be what causes that to abate, but I do think this is a huge, huge advancement in getting there. Anyone with parents who are parents or who have children under the age of 16 have been, really struggling through this pandemic because we haven't had all the tools available to us to keep our children safe. And we know that being boosted is probably the best tool in your toolbox, but it alone will not serve to end this. We know that this has to be an all hands on deck approach. We need mandatory masking. We need testing available for the public, both PCR, but especially antigen with these new guidelines that have been released. And we need all the other mitigation strategies, hand washing, social distancing, adequate ventilation. This is absolutely an all hands on deck approach when you have 2 very transmissible variants in play.
What have you been seeing in St. Louis? Are parents in your area clamoring for that booster shot, or do you think it's going to be a harder sell?
I think what has been really difficult in St. Louis is to see how dramatically our case positivity rate has gone in just a week from 10 to now 30%. We have overwhelmed hospitals and schools starting with very little by the way of guidance, because while these new guidance, the new guidance came out around, isolation and quarantine for the general public, not all the guidance around schools has been updated yet. And we are very much waiting for the CDC to update test to stay, test to return guidance as well. And so it's been very difficult for schools and for parents of young children. What we do know is here we had a robust pediatric rollout for the initial vaccines for ages 5 to 11, and that we have close to 65% of our adolescent age group vaccinated as well. So there's definitely parents who want these boosters, who have been eagerly waiting because they know that their children don't have the maximal protection until they get boosters in hands.
You know, here in D.C., we've been deep in the Omicron deluge for weeks now. Every hour you hear about a new member of Congress or administration official who has tested positive. Today, it's the Secretary of Defense. But many of them say they are experiencing mild symptoms. Is the medical community, in your view, prepared to say that Omicron is generally milder than Delta?
Yeah, I'm an infectious diseases doctor by training, but I'm also a public health expert. And I do not support the use of the word mild because it's very, very misleading, right? If you're talking about mild symptoms in an individual, yes, there's preliminary data to suggest that many of the people who get this are not in hospitals. But if you're looking at this from a population level, from a systems level, right, from the community level, I don't know that that matters because with as many cases as we're seeing not only are hospitals overwhelmed, but we're seeing hospitals not even have staff available to take care of people. So the end result, the outcome, is that people are sick, people are dying because of the net outcome. So I would like the messaging to be clear that we shouldn't make people feel comfortable by this term mild, even when it's being used appropriately. We need to alert people to the state of emergency that we're in because of the downstream effects. And that is what I would like to see more messaging about.
You know, that is such a good point, especially when you look at the numbers surrounding childhood hospitalizations up 66% in just a week, and the reality that many of these children's hospitals have a very difficult time dealing with an onslaught of new cases like that. It crowds out all kinds of other diseases and illnesses that need attention. And of course, you've also got plenty of medical professionals who are themselves contracting the virus and have to stay home. So give us a realistic assessment of what pediatric hospitals and other medical facilities are facing in St. Louis right now.
It's the worst we've ever seen it. We've never seen anything like this. And why that should scare people, why that should alarm people, why that should make people listen more than ever to trusted messengers and trusted resources is the last time we saw numbers this high, we didn't have a vaccine. We didn't have the type of testing capabilities that we have now. We didn't have as much knowledge as we do. So what we're learning is that if we don't take this seriously and march along to herd immunity in the way that we've been calling for 2 years now, 2 years, we're going to continue to see other strains. And we're really rolling the dice as to whether those new strains are variants of concerns or if they'll be inconsequential. But that's not something that I feel like we can continue to play with. I have taken care of these patients in hospitals. I have had to be the one to tell family members that they've lost a loved one. It is not something to be played with. And so for me, the call is to the federal government to give us everything we need. It is unacceptable that I cannot send a test as the director of health to every available household in St. Louis, an antigen test. It's unacceptable that I have people scrambling, waiting in lines, waiting days to get a PCR test in the United States of America. It is unacceptable. And it is unacceptable that we have so much confusion around what is appropriate and what is not with isolation and quarantine. We need leadership from the top down. We need leadership to intervene so that the buck doesn't stop with me, a lowly public health official in one city, and for that to look different from city to city. That cannot be where we are 2 years in. It's just unacceptable.
And because that problem clearly is not going to change overnight, and because getting tested for COVID has been such a challenge for many Americans, just break it down for us and remind people what the most common symptoms of COVID, and particularly the Omicron variant, are, so that they are aware of the possibility that they may have symptoms of COVID, even if they can't get their hands quickly on a test.
So you should stay home if you feel sick. because you do not want to potentially make others sick with COVID, with flu, with any of the other plethora of respiratory viruses. And symptoms include, but are not limited to, fever, chills, congestion, headaches, fatigue, muscle aches, even nausea and diarrhea. These are all common symptoms. But you know what another symptom is? Not really a symptom, but I'm just going to put it right there alongside, is going to be if you come into contact with someone who also has COVID, even if you don't have any one of the symptoms on your screen right now, that to me should be another symptom that should drive you to stay home, get tested, and keep other people safe. You should always be masked. Always be masked at this time, indoors, outdoors, vaccinated and unvaccinated. And listen, I get it. I get all of the people that were naysayers having a field day saying we have lied and vaccines don't work and things of that nature. And I will take responsibility. As public health officials, there's a lot that we haven't done well around messaging. I'll take that on the chin. But at the end of the day, medicine is not a monolith. It's not static. Infectious diseases are not a monolith. They're not static. You will get quotes from me, from Dr. Fauci, from Dr. Walensky that sounded different at one stage of the pandemic than another. And that's because not all variants have been the same. They haven't acted the same. So at this point, if you're sick, stay home. If you have access to a test and you have any of those symptoms or you've come into close contact with someone, even asymptomatic, get tested and stay home.
Dr. Hlatshwayo Davis, thank you so much for the reality check, for the advice, and of course for everything that you're doing to keep your community of St. Louis safe. We really appreciate you joining us.
Thank you so much for having me.